So welcome to the next episode of the Explain series, and this is going to be a question and answer session on circumcision. I've got a list of questions here that have been sent in to me, but please note I'm not a urologist, I'm a sexual health doctor. Okay, so I'm the medical side of urology, if you like. And obviously I deal with a lot of sexual health. So the first question really is regarding partial versus full circumcision. Well, a partial circumcision is where only a bit of the foreskin is taken away compared to a full circumcision. Now, a full circumcision, there are many different types. You have medium, low loose, low tight, high loose and high tight. I'm not going to go necessarily into those definitions because all of those 5 types of circumcision, you're just removing the whole of the foreskin, and basically it's going to be, is it going to be a little bit baggy or is it going to be nice and tight? And that is very much a personal preference, and also a surgical preference as well, because some urologists will prefer a slightly looser fit, and some, because they may not necessarily know how much you're going to expand when you get an erection, and some will tend to have a bit of a tighter fit. Babies who tend to have a circumcision grow up to have generally a tighter fit. Adults who have a circumcision tend to have a little bit of looser skin, but it is very much dependent on the expertise and experience of the surgeon, and also the personal preferences and wishes of the adult patient. In terms of the different techniques, well, when it comes to circumcision of babies, there's lots of equipment and various other bits and pieces you can do. For adults, there's the dorsal slit and the sleeve method. I'm only going to talk about the dorsal slit because, as I said, I'm not a surgeon, and that's basically where the foreskin is cut on the top, straight down, and then the foreskin is then generally removed. So what are my thoughts on a full circumcision or a partial circumcision? Well, partial circumcisions done as adults is usually a cosmetic procedure. I'm not aware of a partial circumcision being done for any other reason, because if you've got phimosis or paraphimosis or any other problem which needs a circumcision, then really you'll probably have a full circumcision. And a full circumcision usually means the frenulum will get removed as well, so you'll have a frenectomy. Now, there are frenulum sparing procedures out there, but it's a question of why you're needing the circumcision. Because if you need a circumcision because the frenulum is not coming back but the actual foreskin is fine, then you probably don't need a circumcision, and then you'll just need a frenectomy. Okay, and that's where the frenulum is the piece of skin going from the glands of the penis going to the shaft of the penis. It's like it's also called the banjo string, and it's that which is removed. Sometimes it can just be cut, and sometimes the actual segment can be removed as well. And if it's needed to be done because of scarring, because it's causing lots of pain or it's continually ripping, then it may need to be removed.